What would happen if you ate lard for 30 days? How would it affect cholesterol, blood pressure, and blood sugar levels? In this video, I'll discuss saturated fats. I chose lard as an example because it's a topic you often ask about. It's the most common question I get, even more than diabetes or thyroid issues. Surprisingly, lard is a hot topic with many conflicting opinions online. This video will only present information based on scientific evidence. I'm not sharing personal opinions, just facts. That's crucial to understand. It's not about what I think, but what research shows. I'll provide references throughout the video. Let's start by comparing vegetable oils, olive oil, corn oil, sunflower oil, coconut oil, and lard. To start, they have a slightly different composition. This difference in composition is due to the fats. On one side, we have mostly saturated fats, like coconut oil and lard. On the other, we have vegetable oils, corn, sunflower, and olive oil. We study how consuming more saturated fats affects the body. The recommended max intake of saturated fats is about 6 to 10% of total calories. So on a 2000 calorie diet, you should consume at most 22 grams of saturated fats. The American Heart Association sets this number lower than the 10% I mentioned. They recommend 6% of calories from saturated fats. This means you'd consume about 13 to 14 grams of saturated fats. That said, you've seen it's important to limit saturated fat intake. Saturated fat isn't bad, but excess of it certainly is. First, it provides more calories, but that's not the only reason. This type of fat can increase your LDL cholesterol, the bad cholesterol linked to increased cardiovascular diseases, such as stroke and heart attack. So it's crucial to watch your total saturated fat intake. Despite claims online that saturated fat is good for you, that it's food for the body, which may be partly true, but you still need to limit the amount significantly. For perspective, lard contains about 40% saturated fats. Olive oil has much less. If I had to rank oils you often ask about, olive oil would be first, then vegetable oils like sunflower and corn oil. Lastly, lard and coconut oil. Coconut oil is also high in saturated fats, even more than lard. So, be cautious about what you read online. What happens if you consume excess saturated fat? We've seen how easy it is to overdo it. Adding lard to your diet can quickly lead to excess saturated fats. Why? Not just lard and coconut oil, but bacon, pork rinds, and dairy have saturated fats. When consuming dairy, opt for low-fat options to reduce saturated fats, sometimes to zero. So low-fat foods are quite beneficial. Other foods like meats also contain saturated fat. So you see, this recommendation isn't about avoiding it completely, but limiting saturated fats to 6 to 10% of your total calorie intake. Reading labels and knowing your food is an easy way to do this. I know it'll be tricky at first when you start tracking your saturated fat intake, but after a few days you'll know the content of most foods. This really works in practice. I've seen it with my patients. You'll eat mostly the same foods, not drastically changing your diet week to week. You'll gain knowledge as you go. So what happens with excess saturated fats? Why does the American Heart Association say this? Studies show that people consuming high-fat, saturated diets had more heart disease, so you'll increase your risk of cardiovascular problems. The second change from increased calories is weight gain and more body fat. There are many videos about this. I'll explain how it works. A low-carb, high-fat diet could use body fat for energy by changing metabolism. This can happen, but you must severely restrict calories. Most people on high-fat diets can't cut enough calories to reach 1,600 or 1,500 calories daily, which is needed to achieve the effect of using body fat for energy. In practice, people who eat more saturated fats tend to consume excess calories. Why? Because you need foods with fiber and high density to feel full while reducing calories. So calorie control is as crucial as the balance of proteins, fats, and carbs. You have to consider total calories. Weight gain and increased body fat from a high saturated fat diet can raise diabetes risk. I'm not just saying this, studies show it. A diet high in saturated fats increases the risk. You might think, I ate pork rinds once and I don't have diabetes or high blood pressure. which also increases with body fat. That's why I'm talking about eating it for 30 days, suggesting it would become part of your routine. It's not about occasional indulgences like at a party where they're serving pork rinds. You don't have to avoid it completely, but it's not about extremes either. It's not about total restriction. You've seen that small amounts of saturated fats can be part of a healthy diet. Another notable change that can occur in your body is increased cholesterol, especially the bad kind, LDL. And we know that LDL is indeed a risk factor for cardiovascular diseases. So we have a point here that LDL values should be individualized. For instance, imagine someone who's had 2 heart attacks, has high blood pressure and diabetes. Their LDL target should be much lower than for someone who's an athlete, doesn't have diabetes or high blood pressure, doesn't smoke, and never had a heart attack. So this low-risk person can have an LDL around 130, okay? Scientific studies back this up. It's not just about cholesterol, but other risk factors too. I should mention this while we're on the topic of saturated fats. On the flip side, someone who's had a heart attack might have an LDL goal of about 55, just to give you an idea of how it can vary. That's less than half of what's okay for someone with no cardiovascular risk factors. Remember, triglycerides are also affected by a diet high in saturated fats, contrary to the belief that they only increase with high sugar intake. This isn't a myth, it's true. The main way to control triglycerides is by cutting sugar. But studies show that a diet high in saturated fats can also cause a slight increase in triglycerides. So if you're watching your triglycerides, it's best to avoid these, okay? The foods I mentioned earlier. There's another interesting point about chicken. I forgot to mention this when I was listing the foods. Chicken skin is also high in saturated fats and can worsen cholesterol issues. So you now understand the values. Doctors need to assess all risk factors to determine the LDL goal and whether the patient needs to lower it or if their cholesterol is good enough as is, value itself. For HDL cholesterol, we do have a target value. Generally, we want above 40 for men and 45 for women. Some studies suggest above 45 for both, okay? Without differentiating between men and women. But if you're at that level, I'm satisfied with the reduced heart risk. And for triglycerides, preferably below 150. Remember, you don't need to fast for triglyceride tests anymore. If you haven't fasted, the level should be under 175. A high saturated fat diet also raises anxiety and depression risks, so it's crucial to watch what fats you're eating. Inflammatory markers like ESR and C-reactive protein increase with high saturated fat diets. Sure, some may eat more saturated fats but lead a healthy, athletic lifestyle. This isn't absolute truth. I always stress this in my videos. So, what should you do in practice? I'll share the best options and address main issues and myths about these fats. First, what fat do you use for cooking? And which part of the world are you from? I use a non-stick pan without fats, and I'm from Porto Alegre. Now share your city and the fat you use most often. Unfortunately, lard is widely used here. Let's start by discussing olive oil. You've probably heard olive oil loses its benefits when cooking veggies or heating it. That's not true. Olive oil only loses its properties at much higher temperatures. You can't reach those temps on your home stove, so feel free to cook with olive oil on the stove without worry. For vegetable oils, myths claim their fats harm your heart and cause heart attacks. That's also a myth. These oils contain unsaturated fats. Videos claim people lived longer without heart attacks, but life expectancy was actually lower. As a result, there were fewer heart attacks, as people died earlier from other causes. They didn't live long enough to develop cardiovascular diseases. As people live longer, the chance of having a heart attack naturally increases. We now know that the idea about all vegetable fats being healthy is a myth. Some vegetable fats, like coconut and palm oil, require caution. That's true. It's not about being vegetable, but the amount of saturated fat in its composition. You might ask about butter. Butter also contains saturated fats. Just so you know, if you like using butter, it's worth moderating your intake. Why? Because over half of its composition is saturated fat. Even a small amount can reach the calorie limit I mentioned earlier. So you need to be very careful with butter too. What's next? What about lard? Doesn't lard have any healthy fats? Well, it does have a bit, okay? It has some healthy fats like linoleic acid. There are some healthy fats, I won't lie, but over 40% is saturated fat. So yeah, this balance isn't really good for your body. It's better to go for the ones I mentioned first. I'd like to answer more questions. I'll wait for common ones for part 2. What do you think? Leave your questions about fats and nutrition in the comments. Believing a lie and acting on it can really harm you. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more like this. Now I'll suggest a video where I talked about diabetes. What's the best breakfast for diabetics? Breakfast helps prevent blood sugar spikes. In this video, I discuss the ideal breakfast for diabetics. It's useful not just for diabetics, but for general health too. Take care, see you next time.